again, I want to remind everybody to please refrain from clapping or booing or anything else, please. Let's respect the speakers.
Hi, good afternoon, Dr. Friedman and the Board of Education. My name is Claudette Poole. I live in 4444 Galen Cove. I am a pediatric infectious disease physician. I work here in Birmingham. I also oversee infection prevention, and I have a master's in public health and epidemiology. I've been taking care of children with COVID since the start of this pandemic. I've been having to follow the science and the literature and the guidance to come up with recommendations. I am not here today as an advocate for my own children who attend the school. Go Rebels, they're playing both volleyball and football tonight, but really to advocate on behalf of all the children who will get sick from this virus before this pandemic is over. I was asked to come speak today, I have to confess reluctantly, in response to the health and wellness plan. It is often cited that COVID is not dangerous to children, and this is true when we compare it to older adults. Children, by definition, should not be hospitalized and should not be dying. I don't want it to obscure the fact that COVID is causing severe disease in our children. For the last month, we have had a steady flow of children in Children's Hospital admitted for COVID, many of whom are being taken care of in the ICU. We are very good at what we do, and thankfully most of these children go home. And a week ago, I would have said they all go home, but we lost our first patient last week, and this was a young boy, well not a young boy, a young man, who was attending school the week prior to coming into the hospital. I am fielding multiple calls every day from providers looking for my assistance to help them get monoclonal antibodies to treat their high-risk patients. And I want to remind everyone these high-risk conditions in children are actually very common. It includes things like asthma, diabetes, and being overweight. Not to mention all the children living in our community who are fighting cancer and living with chronic health conditions. Since the start of this pandemic, we have treated over 100 children with a very serious COVID-related condition known as MIS-C. And as this community outbreak is increasing, we're seeing more of these children come to the hospital desperately ill. We have more and more pregnant women being admitted to the hospital, to the ICU, many of whom are having their babies delivered prematurely as these moms are being placed on ECMO and are dying. As this awful pandemic is unfolding, we have multiple organizations whose sole purpose is to enlist the help of career professionals who have both the expertise and training to comb through all the data, to review all the literature, both the published and the unpublished, to have lengthy debates, and then to publish guidelines. These organizations include the Center for Disease Control and Prevention, the American Academy of Pediatrics, the Infectious Disease Society of America, our health department. And after these guidelines are published, they're made available for all the other organizations who have to draft policies, such as hospitals, long-term care facilities, places of work, daycares, and schools. Children's of Alabama just issued today strong recommendations in response to what's happening locally in our community. They strongly recommend the following to help keep our children safe from the spread of the virus as they return to school and school activities. Masking for students in the in-person school setting, regardless of vaccination status. All others, especially unvaccinated adults, should wear masks inside buildings at all times, especially around children under 12 years of age who are not eligible for vaccinations. Full vaccination for those who are 12 and older. Avoiding large crowds and socially distancing to the extent possible. Hand washing and or use of hand sanitizer. Dr. Friedman has released the numbers of children who are being kept home due to COVID diagnosis, And I just want to remind everyone, this is in the context of an absent statewide mask mandate, limited density reduction in schools, and the Delta variant that is 2 to 3 times more transmissible. And this really does have the potential for a very rapid and large outbreak amongst our school-aged children. The current wellness plan is out of alignment with the recommendations that have been published by all our trusted health organizations, including now Children's of Alabama. And as a consequence, the burden of proof is on you to justify why. And that's why I think there's so many people here for public comment. Myself and my colleagues who are taking care of these children are urging the board to reconsider disregarding these recommendations and bring them back into alignment. Thank you.